Yes, thank you. Thanks for
Except
the
for the item from
I thank you for the opportunity to speak before you today. I'm speaking about Resolution
I
647.
apologize. I say, please kindly state your name and town of residence
Yes.
for the record.
Yes.
And the resolution that you're referring to, and please adhere to the 5-minute time.
Yes. Resolution 647, Thomas Sullivan. I'm representing Horizon Healthcare, and I'm not a resident of the county. I'm a resident of Delaware, and for the company I cover the Northeast, all the contracts in the Northeast. Horizon has been honored to service the county as your provider of health care for the past 16 years. It has been a very successful relationship that we're very proud of. We obtained accreditation by the National Commission on Correctional Health Care in 2014, and we have maintained that accreditation. Our utilization management is the team that reviews outside hospital and secondary care expenses and costs. We have returned the county $1.1 million over the term of this contract, which is 5 years. In 2015, we expect an estimated another $300,000 return funds under this secondary care obligation of our review. As I speak to you today, I do represent Horizon Healthcare, but as someone who fully understands the delivery of healthcare systems and has held multiple positions besides Horizon. I'm a retired warden with 27 years in the New Jersey Department of Corrections, and during my tenure I did chair many evaluation committees for inmate health services. When I retired from New Jersey, I was appointed as a director for the Maryland Department of Corrections and Public Safety, and in that capacity I also chaired and sat on several evaluation committees which looked at inmate health care. I was an executive member of the American Correctional Association, and I was also a chairperson for the Coalition on Correctional Healthcare Administrators, which actually review policies and healthcare contracts nationally and set national standards. So I can easily testify that Horizon's performance and hard work and expertise in cost control and utilization management, as evidenced what I previously stated, the recoveries, is alone a reason to keep us on as your healthcare provider and not warrant this contract to be awarded to another provider. We are unmatched nationally, the largest company nationally, and certainly we're unrivaled in New Jersey in the areas of this procurement and management of your costs. That alone should stand for a good reason to award the contract to us, the incumbent provider. But I want to consider a few other serious things that impact on a transition into a contract. There are other additional costs. Now, indeed, under the contract, the responsibility for transition is the responsibility of the new vendor and the costs associated with it, but there are other costs that we don't always think about and we don't always consider. There is the cost of training new staff because this is a correctional environment. There is a cost of conducting background checks on new staff because this is a correctional environment. There is the cost associated with new policies and procedures that affect the delivery of health care. And again, in a correctional setting, it's not simply a policy that relates to inmate health care, it's a policy that relates to custody and security, so it requires your county employees to be actively involved as well. It creates additional work to do this major type of transition. We are a physician-led company. We are an experienced company. We have the resources to provide good care here. We have provided good care here. We have the resources to control the other costs of outside hospitalizations, emergency room trips, and the other resulting increases in costs in both medical, external care, as well as the cost of custody overtime. We have smoothly ran this contract for 16 years now. The loss of our support to both the county and to our employees will surely be met. The other costs will arise out of transition of staff. Some staff will transition to the new contract. Some staff won't. Some staff may choose to take another position within our company. Some staff may leave down the road. But you will be transitioning new people and new staff into some of the key management positions which have led to the success of this contract. The bottom line is that continuity of care, medical record keeping, policy development, staff training, oversight of outside components, outside hospitalizations, all start anew with a new vendor. Now there are esteemed colleagues from other companies that do this, and they will come up and they will tell you that they can do this. But there is a learning curve and there is a transition when you go from one company to another, as opposed to keeping the incumbent who has been fully competent, fully capable. The difference between our proposed bid and the low bid is $14,000
Thank you
annually.
very much for your time.
Thank you.
All right.